Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Now let's look into the classification, and this is of the wound closure and also the healing. So first is the healing by the primary intention. So this is the first intention, the opposition of the wound edges, the minimal surrounding tissue trauma with the minimal inflammation. Next is the associated with the best scar and often a hairline scar. Next is the healing by the secondary intention. So secondary intention is it occurs when the wound is left open to heal through granulation, then by contraction and also by the epithelization. It is increased risk of infection. Next is they also may require antibiotic prophylaxis. Now it is associated with the cosmetically poor and larger scars. So it is cosmetically it is poor because it can lead to scars. Then is healing by the tertiary intention. So in tertiary intention it occurs when the wound edges are not initially opposed. So they are not initially opposed and typically in contaminated wounds. Their delayed closure is performed when the inflammation and the proliferation phase are well established. So in case of the inflammation and the proliferation, they are well established. Next is it is associated with a less satisfactory scar appearance. So less satisfactory scar appearance. To learn and grow daily like this, please do subscribe.